Thank you very much, Representative Betts.
Sounds like
Good evening, sir. Good evening.
Thank you so much for the opportunity to be here today. I have written testimony that was submitted, and I just thought I'd kind of try to put a face on what I'm dealing with and the impact of what's happening to Bristol Hospital. I am the president and CEO of Bristol Hospital. When I got in this business, I thought all you had to do was do the right thing. It was deliver high quality care, safe care, at a very good value, a very good cost. And by every metric, Bristol Hospital's done that. In fact, we're actually ranking at the national level in the top percentiles for our outcomes. We have ticked off award after award after award. The team at that hospital is amazing, just quite frankly amazing. And I'm faced now, this last year, to give you some metrics, right? So we delivered millions and millions and millions of dollars of care to the poor in our communities, the people that can't afford it, of charity care. We expanded to support the hospital's initiative in the expansion of the Medicaid program. We recruited 13 new specialists to our community and subsidized the startup costs of those practices. Why? Because the specialists don't take the state Medicaid program. They won't take it unless I subsidize them. And as a consequence of the tax, I paid $7.5 million in tax last year. $7.5 million. 13 new startup practices, millions and millions of dollars of charity care. I lost $1.8 million, and now I am in serious cash flow situation. Like I said, all I thought I had to do was do the right thing, support the initiatives of the state, take care of the community. So when you think about that, right? So how does that play out? I broke even last quarter, which was a monumental feat, given the fact that I pay $7.5 million, almost $7.6 million in taxes, right? I am so far behind on my supplemental payments from the state, $2.3 million. Right now, the impact to the businesses in that community, I am holding accounts payable because I have to make payroll and I don't have the cash to make it. It's shameful. It's shameful that this state is taxing that hospital and taking the money that was designed to take care of the care of those patients in that community. And I'm struggling, literally struggling every day to balance my dollars because I'm not getting paid and you're taxing me. It's a nonprofit charitable hospital that is doing what it's supposed to do. And as a consequence, due to no fault of my own, because of the situation of the state, you're taking those dollars away from the hospital right now. And the supplemental pools, I don't believe them. Those payments are held. They're held so that, there was questions earlier about why they're held. They're held because they might be rescinded. We've seen that happen time and time in the past. Okay, I can't even count on getting them on time. So now the impact is to the businesses in the community, right? It's a struggle every day, and it makes absolutely no sense to me when I try to do everything for the right reasons. I try to accommodate every request from the state. I try to cover all those patients that are on Medicaid, the 750,000 patients, make sure they have orthopedic care, make sure they have all the specialty care. You're not going to have that if hospitals don't subsidize it. So what's the answer here? I mean, I just want to run my hospital. I don't want to have to fight for every penny, and I certainly don't want to be giving back money that belongs to the community that I serve. So please, you have to end this tax. It is shameful. It is absolutely shameful. It's just not right. Thank you.
Thank you, and thank you for your passion. I think we've all heard from a lot of your members, and this is something that a lot of information has been received by all of us. So I do expect us to have a big conversation about this, and we will make sure that we'll invite the hospitals to that conversation.
Thank you. I really appreciate that.
Thank
you very much.
And he's just jealous. He likes your haircut.
He will get there someday.
How do you know he's not there now? Representative.
For the record,
It's your hair.
I'm Representative Whitbetts, and I'll have my hair going into my grave. So.
He's an owner.
I know. Thank you very much, and all kidding aside, I really feel very badly for you and the hospitals. I know how hard you worked. I did not know that the hospital, frankly, had subsidized the care that the poor and indigent patients were getting so they could actually get the care from the specialty practices. So I learned something new today. I did not realize that, but that's something we all share in common. As you say, we're trying to do the right thing for the right reason. I had asked Steve Frame before because I had heard some stories, but I just frankly don't know what the answer is. If community hospitals start closing, okay, I don't know if that's happened anywhere around the state or in the neighboring states, but are you aware of any information of the impact of community hospitals closing? And if you are, if you could just share that with us, that would be great.
Yes, Representative Betts. The State of Massachusetts Health Policy Commission, which is extremely well funded, spent a year researching the 9 hospitals that closed in the state of Massachusetts. That report is available online. It has a 6-page executive summary, which is unbelievable. And they hired researchers.
Could you just send a copy of that to the committee? Just the executive summary.
I absolutely can. And what prompted them was the closure of 2 additional hospitals and the outcry and the limitation of access to the communities that they served. And, so essentially what this report says is that the closure of those hospitals had a profound impact on the cost of healthcare in the state of Massachusetts. That as those community hospitals that close, the smaller ones that tend to be lower cost, provide just as good quality outcomes. That was their conclusion. There's nothing that says that a community hospital that's a freestanding hospital doesn't provide the same level or quality of care for the services it provides. It has had a profound exponential impact in those communities and increase in the cost of care. Similarly, the state of New York went through a process of closing hospitals where they had 2 hospitals in the same town. And the conclusion, the retrospective look at that whole picture was that they actually created monopolies in those communities and actually increased the cost of care in those communities. So in terms of the dollar cost, we are working so hard to try to figure out how to reduce the cost of healthcare in this state and make it more attractive for businesses to come here and locate here. And with the hospitals closing, the small community hospitals, that's exactly what's going to happen. You're going to increase the cost of care, and you're also going to limit the access of care to the communities that they serve. So I'd be glad to send that report. Thank you for asking.
Thank you. Thank you. Very quickly, how many hospitals do you know did Massachusetts have before those 9 closed?
I don't. I think it's in the report. I just know that what they talk about is 9 closing, and they go through the reasons why they closed. And it's a quick 6-page read. So thank you so much.
Thank you. Thank you, and have a good evening. Martin.